So I think it's a vital tool in veterinary dentistry. You know, we've just explored the reasons why we need to take x-rays, but to summarise, preoperative assessment of the extent of the disease, making your diagnosis, treatment planning, and then monitoring that disease progression, definitely client communication, and also practice profits. And this was a case I saw many years ago, but this cat had that premolar extracted, this mandibular premolar, because it was mobile. The extraction site then did not heal, and this cat was referred to me for an infected extraction site or a non-healing extraction site. The practice had not, unfortunately, taken a radiograph, but the first thing I did once the poor cat was anaesthetised was get the x-ray in, and that's what we saw on the radiograph. So talk me through what you're seeing on that radiograph. Or not seeing. There's no jawbone there, absolutely. The jawbone in this area really is negligible now. So what, I know nurses, you're not supposed to make a diagnosis, so vets in the room, what are you thinking of your differential diagnoses when you see this? And nurses, I'm not saying you don't have to get chipping in today, but please feel free to say what you see, because sometimes vets will say to you, well, what do you think? What should I do? And they put you in an awkward position to make a diagnosis when you don't want to. So feel free, in the confines of this space today, feel free to make a diagnosis and chip in. Yeah, so we're thinking potentially some kind of neoplastic disease, benign or malignant. What's more likely to give us a very destructive bone pattern? Yeah, so some kind of malignancy. And what's the number one malignancy in cats' mouths until proven otherwise? Squamous cell carcinoma. So no wonder that tooth was mobile. You know, there was no jawbone there to support it. But if the practice had taken an x-ray, okay, the outcome for the cat might not be any different. It's still a very grave prognosis, but the client's journey would have been significantly different. You know, they had to come expecting me to sort out a non-healing extraction site only for me to say, I think your cat might have mouth cancer. You know, and that's a very different experience for the client. Sometimes I get sent x-rays like this, and as you can probably tell, well, what can you tell from that x-ray? It's a cat. It was lying on its left side. So yeah, we really need dental radiographs to actually assess teeth properly. There's too much superimposition with skull radiographs, so if we want to look at teeth individually, then we need dental radiographs. And when we're looking at this patient clinically, hopefully you can all see there's something significantly wrong with this molar tooth. What is our primary differential for the lesion on this molar tooth? There's only a few things it could be, which is great in dentistry. What do cats get? What makes vets swear when they're doing feline dentistry? Resorption, exactly. So we think that's some kind of resorption lesion. But what we don't know is what type of lesion it is. How are we going to treat it? Are we going to try and attempt a full extraction, or are we going to do the crown amputation? And that's our radiograph. So what do we want to do with that molar tooth? Yeah, so extract the root that's intact. We can see a periodontal ligament nicely around it, but this one has now disappeared. This has undergone what we call replacement resorption. So there's no point wasting time trying to extract this root that's no longer there. I do a crown amputation here, but I extract that root. And we can see that this tooth is actually undergoing resorption as well, so we would need to crown amputate that one. And don't worry, we'll go through all the interpretation of resorption later. So everybody wins. Your patient's going to benefit because they have their diseases or their pathologies detected and hopefully treated optimally. Client perceives better value for money, so they can see why they've spent their hard-earned cash. The practice will gain financially, and at the end of the day, you can go home and think that you've done your job as best as you possibly can for your patients, which I think as veterinary professionals, that's what matters to us.